My name is Dr. Laura Downey. I am an Associate Professor in Health Economics and Policy at UNSW and Imperial College in London, and I lead our global program for universal health coverage, which is a sustainable development goal that articulates the ambition that everyone, everywhere should have access to safe, affordable and high-quality essential health services when they require them. But today, only a small proportion of UN member countries have actually achieved this. And the progress that many countries have made, hard fought over the last few decades, is being eroded. When universal access to safe and affordable healthcare is compromised, it's the health of women and girls that is most impacted. Now, I started my postdoctoral career as an analyst at the National Institute of Health and Care Excellence, or NICE, in the UK, where I synthesised health and economic evidence to inform policy interventions in the UK around which interventions the government could afford and which it could not, which is why NICE earns the reputation of being called nasty sometimes. In 2015, I was seconded to the Ministry of Health in India, working in partnership with the government and the World Health Organization to support the development of this kind of function to support India's 1.3 billion population. I stayed for 4 years, and during this time, I was exposed firsthand to a changing climate and environmental extremes. Summers got longer and hotter in Delhi, where I lived. In Kerala in the south, mass flash flooding wiped away whole villages. These events were followed by sharp rises in heat-related mortality, deaths in infectious diseases like dengue, chikungunya, and later Zika virus. Conditions that are bad for anyone, but catastrophic for pregnant women. I anxiously watched from afar the news coming out of Australia over the same period of time. The Victorian bushfires that devastated whole communities, cyclones that battered the coast again and again of Queensland, and the day in 2020 where here in Sydney and Penrith at 50 degrees Celsius was the hottest place on Earth. What has become very clear to me is that climate change is the most pressing threat to population health. As an amplifier of inequity and what we call a threat multiplier, means that it's the health of women and girls that suffers most. For example, they're 14% more likely to die in a climate emergency. They're 80% more likely to be displaced post-climate emergency. During extreme heat events, which are increasing in both frequency and intensity year on year, including here in Australia, rates of preterm labour, stillbirth, miscarriage, and gender-based violence all increase exponentially for every degree above seasonal average. And yet, these statistics remain largely marginalised to small pockets of academia. There is a gross lack of awareness of this issue, of meaningful action to better understand who is at greatest risk, how are they at greatest risk, why are they at greatest risk, and what can we do to utilise this kind of data to ensure that we're looking forward to the future and protecting those who are at greatest risk of ill health, exacerbated or caused by a changing climate. Concerningly, at the same time, women's voices are also being marginalised in the very conversations and policies that shape their health and their future, and this has to change. That is why I, together with colleagues across our region from government, civil society, academia, healthcare practitioners, have come together to found SheCan, the Strengthening Health Equity Climate Action Network. Our vision for SheCan is very simple, 3 interconnected pillars. First, strengthening people, to build capacity to engage, to advocate, to collect data and utilise that data, to participate directly in policy dialogue and priority setting. Second, to strengthen systems, to better collect routinely gendered health vulnerability data, guided by the principle that what is not measured cannot be changed. And third, strengthening policies, ensuring that policy making is inclusive and participatory, and importantly, that women's voices are equitably included at the table. As a health economist, I know only too well that the policy dial very rarely shifts until you discuss money. And that's why we aim to also generate the economic evidence to show that these actions don't just benefit women, they benefit all of society. They're good value, good bang for buck. Because what we know is that investing in women is the greatest or the strongest lever for economic prosperity and security. Our ambition is bold: to create the first global network of its kind dedicated to strengthening health equity in the face of a changing climate. We have active engagement and signed letters of support from multiple governments across Vanuatu, Papua New Guinea, Indonesia, over 250 civil society organisations as members of the Pacific Island Climate Action Network, including women's rights and advocacy groups across Oceania and the Greater Pacific. We have multilateral partners in ActionAid and Save the Children. Early seed funding from the Asian Development Bank got us to this point, brought us together, helped us conceptualise these ideas, articulate the key problems that we face in our region and what collectively we want to do about them. We are poised and ready to move. We're hungry. And with the right support, we can launch and scale She Can across our region, turning evidence into action and action into policies that genuinely strengthen systems to protect the health and the future of our women and girls across our region. Thank you.